everyone. Thanks so much for tapping into this time for us to have a conversation relative to how to find health during these unprecedented times. The subject matter tonight is to talk about our ability to sustain health and well-being, improve immunity and resiliency amidst this season of fear and unknown. So I have several members of our care team from Living Well are here with me and going to contribute to this conversation. And so why don't we just briefly go around and just introduce yourself. And we said that we're going to talk about whole person health. And so I think the people that faces I see, I'm familiar with, and I'm pretty excited that we're all here and going to be able to have this conversation. Steph?
Sure, thanks, Pen. So my name is Steph Eisenbeis. I serve as the Executive Director at Living Well Institute, and my background is in experiential environmental restoration and connecting people to outdoor environments and community health and well-being. Karen Gish.
My name's Karen Gish, and I also am a part of Living Well Institute. I am the Director of Integrity as well as the President of the Board. I am a mother with 3 children, and my background is in health and physical education. John to John.
Hey. My name is John Sponegorger. I'm in retirement rehearsal right now, so I don't want to say what I do or what I'm going to do. I'm just excited about the opportunity coming up.
Thanks, John. Angie, did you want to go next?
Hi, I am Angie Morrow, and I am affiliated with Living Well through my son. And I, for the community, I do a lot of addiction recovery things for family and friends.
Thanks, Angie. Kathy?
Hi, I'm Kathy Sorella-Frick, and I am at Living Well, and the nurse, and I just love to take care of people. Ed?
Yeah, I'm Ed Cordeveau, and I'm a retired environmental engineer, and I worked in the water environment program for many, many years, and I realized that the true environment we have to deal with was one inside of each of us and one another. I'm a volunteer at Living Well, and I'm looking forward to the dialogue.
Thanks, Ed. Dr. Andrews?
I'm Janice Andrews, and I'm affiliated with Prescriptions for Enlightening Paths, and I specialize in children and adolescents and grown-ups, so I guess everybody. And the specialty that we have as a subspecialty to psychiatry is functional medicine and biological treatment of autism. Yeah, that's what I do.
Great. Thanks for joining us. And Dr. Curtin?
Sorry about that. I had it on mute there for a second. I'm Dr. Paul Curtin. I'm a family physician in Hershey, Pennsylvania. And I've been involved with Penny for several years. And we're looking forward to seeing what the discussion is about tonight. I just want to warn you, if I log off halfway through this, I have another meeting with my company at 7:30. So you just see me disappear, I just disappeared. Thanks.
Thanks, Dr. Curtin. Penny, you're on mute.
So thanks everyone for being with us. I think, the issue of health and wholeness and the concept of stress is one that I think during the season right now is unavoidable, but I think we have an amazing group of people, and I'm excited to know that not only as as professionals who are passionate about health and wholeness, but also as clinicians. We've got a nurse and a family physician and a psychiatrist, and I'm a chiropractor. But one of the things that we all realize is that stress has huge influences on how our body operates and our ability to be resilient. And so this morning, I had a conversation with Dr. Andrews, and we were talking about what's going on with this virus that has unfortunately impacted a lot of people physically, in the fact that they have contracted it and they've gotten sick, and we've lost people in our community. And I think one of the things that we as healthcare providers, and I have the privilege of co-laboring with Dr. Curtin a lot and Dr. Andrews, and I think we don't want to minimize the importance of addressing the consequences of disease and the virus, but we also want to maximize the reality that a lot of times when we're afraid because of the unknown of how do we get a disease. I mean, this is an invisible, I think Paul and I, Dr. Curtin and I had this conversation. I mean, we're fighting an invisible war right now. And that invisible war is a virus that everyone's afraid of. And then unfortunately, when we turn on the news or we listen to what people have to say, everyone has a difference of opinion. And there's so much conflict and information out there that we as consumers of healthcare and as individual community members, oftentimes it's very, very difficult to determine what's the truth. And so, Dr. Curtin, before you head out, I wanted to just take this opportunity, and some of the conversations we've had relative to being a family physician. Can you give any advice to those who might be listening? How do you recommend and encourage people to stay healthy during this time?
Can you hear me?
Yep.
Okay, thanks. It is a weird time right now. We're doing things that I never thought I'd be doing, and it's pretty much, just dealing with, the unknown of the coronavirus, but the unknown reactions to the coronavirus is basically what I'm dealing with. I just had to call 2 patients back, or families of 2 patients, who were just beside themselves. I mean, I've known these people for 20 years, and they're just beside themselves, and they don't know what to do. And it took 20 minutes for each patient, and I looked at my list, and there was at least a list there of 45 people that hopefully my nurses can call back tomorrow, because, if I called everybody back, and when I was done talking to these people, they felt better and they understood more and they were okay, but it was probably only going to last a couple hours until they turned the TV on or until they started thinking about something. And so I pretty much just tell people, look, you have to take care of your body. And as you're taking care of your body, you got to take care of your mind. And whatever you need to do that, do it. If you think you're going down a bad path, give me a call. If you think, if I turn to drugs and alcohol, then maybe you ought to call me. But if you want to, if you want to binge eat a little bit, or if you want to try a new diet, or if you want to stay healthy by going for a walk or starting to exercise, by all means, do whatever you have to do to take care of your body physically and mentally. And I don't want to say overreact, but the reactions to this unknown or this unseen enemy are worse than the enemy itself, sometimes, because it's putting pressure and stress on all of us. I mean, right now, I don't even feel like talking to you guys. I just want to go home, shut the door, and get ready. I got to go back in at 7:30 tomorrow and start dealing with the reactions of the coronavirus. And we have yet to see one coronavirus patient in my office, but we're dealing with it constantly to the point where I'm all stressed out. That's about all I can tell you right now. I mean, the mental health dealing with the unknown is going to be important over the next couple weeks. Hopefully only the next couple weeks. That's all I have for now.
Penny, you're on mute.
The one thing about Dr. Curtin is he doesn't pull any punches in being real. And I appreciate that. I think, I think the reality of this for all of us. I mean, my husband and I are chiropractors, and in our practice, people get stressed and then they experience pain. And a lot of times we can provide some clinical intervention, whether that's a pill or a procedure. But I think we really, from a clinical perspective, and we're going to hear from Dr. Andrews and Kathy and anybody else on our team who wants to contribute. But I would say that we can talk about what happens when our mind gets stressed out about unknown. How does that break down physiologically to our body? And then, even though we have these conversations, Dr. Curtin and I, relative to mind-body medicine, we also at Living Well, when we talk about whole person health, also talk about spiritual health and well-being. And I would say, as Dr. Curtin said, providing reassurance to people who are afraid is probably the most valuable resource we can provide to each other. It's just encouragement. And sometimes if you sit and listen to someone as they express their fears, even when they start to get them out, they realize that they're actually not even rational thoughts. But when they're in your mind and they're inside of you, your body starts to get into fight or flight mode. And Dr. Andrews, how about, would you mind taking a little bit of time and utilizing your expertise as a psychiatrist and a functional medicine physician, talking about the coronavirus and what it does to your body and how we might address it?
The reaction of people, is that what you're talking about? I can't talk about the virus, but the people.
Yes.
Well, we've heard that it's very inflammatory. The lungs become very inflamed, and then it's just all downhill after that. And we also have learned that when there's a fear response, we excrete those little peptides, those little inflammatory peptides that get right into the cells, whether the brain and all the tissue, any tissue that it has access to, and they trigger a cascade of more inflammatory chemicals, and that's the end of the game right there too, because that's like setting a fire, into that area. And so there's no pulling back. There's no pulling that back. And that's why the emphasis is on the prevention of, because you can't pull those little hormones back, those little peptides, you can't pull them back. So once they're loose, they just inflame the whole area. They're just like putting kerosene on a fire, and it just goes from there. It's downhill. And so we focus on the prevention, keep that from happening.
And can you explain a little bit when you're stressed? I think relative to the coronavirus, it's funny because so many times in Living Well, when we care for from a person, is that we have people anchored to their breath. And when you think about the pulmonary system, which is oftentimes what happens relative to the coronavirus, is it gets in your pulmonary system and then it inflames your lungs. And I think that's what Dr. Andrews was talking about. But the reality of it is that when we begin to breathe in, and we breathe in, and I mean, we want to breathe in fresh air, but we also want to breathe in positive thoughts.
Yes.
We want to become aware that when our mind is full of stress, and we're not even aware of our breath, or we're hyperventilating because we can't catch our breath, and we're stressed out, it causes our body to become inflamed.
Yes.
And then it doesn't have the resiliency and the ability to fight off these diseases, and in particularly the coronavirus. It's interesting. I've been watching. There's a man who I don't know if he's in his late 60s or early 70s, but he belonged to a church of a friend of ours who's a pastor, and several of my friends know this man who was in the medical center, and he had contracted the virus, and there was a whole group of people praying, and we were watching this every day, that there would be a report of how he was doing it, and you watch this group of people on FaceTime just continue to offer words of encouragement and hope, and they talked about stress and how do you sustain hope amidst scary times, and it's been interesting because today I think this morning I saw that on Easter there was like this huge turn, and they're weaning this man off of the vent. He's starting to breathe on his own, and they were saying it was a miracle. And I think one of the things that we minimize is that our body is this amazing organism that if you love it and you care for it and you honor it, that it wants to take good care of you. And as a chiropractor, I used to tell, because I have the fortune of co-laboring with physicians and other health providers, and sometimes I know Dr. Andrews, I know you do a lot of nutrition counseling and really trying to help people make their body be healthy so that they can fight whatever diseases that they have. And I think that's what you were alluding to, is the fact that we can't, there's viruses and bacteria that we're exposed to. But the real strength comes in having confidence in taking care of ourselves so that we can build resiliency in our immune systems, can fight off, because there's a lot of people who've had the virus and their body heals.
Yes, it's true.
But I think about people who like Dr. Curtin says, he's had 45 calls from people who are stressed out. And when they get stressed out, for some people, you get a headache, or you get tension in your neck. And then you get tension in your neck, and then you get tingling in your hands, and then you sit and are afraid that you have tingling in your hands, and you think you're having a stroke, but you're really just stressed out.
Yes.
Or you get stressed out and you get anxiety, and then you start to hyperventilate, and then you realize that the pollen count is getting higher and higher, and there's allergens in the air, and then you think, oh my goodness, I can't breathe and something's wrong with me. And before you know it, you're so stressed out that you've disconnected your mind from your body, and now your mind is full of irrational fears, and you can't find the present moment.
This is Steph. I have a quick question for Dr. Curtin before he steps off. And before the question, I would just express gratitude from Living Well Institute and our local community here. I think the value of family physicians like yourself who are willing to pick up the phone and have a 20-minute conversation with a family who's stressed out, the level of comfort that you're able to provide. And I recognize that comes with years of medical training and the ability to instill confidence in the people you're taking care of. So gratitude to you and your staff. And I guess I would ask the question as well, for a group of people who are committed as community leaders to helping also take care of our community, whether we have initials before or after name, what would you recommend could be helpful from a grassroots perspective that we could help spread in our community to help, as Dr. Andrews said, from a prevention perspective, and to help carry some of the burden of encouraging other people with relevant information that's simple and understandable, that can help provide some comfort for people who are stressed out and who don't even have symptoms at this point?
Yeah, that's an excellent question, and thank you for the praise. If I was taught how to deal with this coronavirus in med school, I think I must have been asleep during that class because I don't remember it. But the bottom line is, I'll tell you the conversation I had tonight, and it's pretty much very, very similar to everybody's conversation. Is this person, I only see him once a year. He's very healthy. He's probably in his early 40s. He works out all the time. And when he called and said, they want to set up a video conference with me, I said, sure. And so I set up a video conference with him, and his wife was there. And the first thing I said was, wow, I can't believe Superman is finally sick. And he goes, yeah, and he had a big bright smile, and he looked good. He looked like he always looks. And he goes, I a couple weeks ago I had a cough, and then I had a fever, then I had a sore throat, and then I got better, and I thought, okay, that's just me getting better. And now all of a sudden I just don't feel right. And I said, well, are you short of breath? And he said, no. And I just went through all the symptoms. I said, do you have a fever now? Are you coughing now? And he said, no. And I said, well, what's wrong? He goes, I just feel like maybe I have the flu or something's not right. And his wife was sitting next to him, and she was concerned. And, I just had to go through the checklist for him. And I said, look, you're still Superman. And you're probably Superman who got sick and maybe even got the coronavirus, and you've already kicked it. So what are you worried about? And they're like, well, I don't know. I'm sitting here with my family, and I don't know if I have the coronavirus and we're giving it to them, or if, what I should do. And I looked on the internet, and I saw this medication, this chloroquine that might work. And I'm like, look, there's no cure for the coronavirus. There's no, you either kick it yourself or we treat the symptoms. Do you need oxygen at this point in time? He said, no, I feel okay. I feel good. I said, are you coughing? Do you need ventilators? He said, no. I said, do you need IV fluids? He said, no. I said, we don't treat the coronavirus. We treat the symptoms from the coronavirus. And if you're not having them, then there's a real good chance that your immune system or nature or God or someone's taking care of this by themselves, even if you have it. And so what I would recommend is, if you're really nervous, we'll get you set up for testing. And if you test positive, then there's a good chance your whole family's positive. And, we'll just keep a real close eye on everybody, knowing that the coronavirus is in your house. But chances are you guys have taken care of yourself. His wife is just as healthy as he is. And that's going to pay off during this time. And then his wife said, well, why would we even get tested then? And I said, well, the more data you have, the better. I mean, if it was me and I wasn't feeling good and I knew I had the coronavirus, I tested positive, then as soon as I'm having trouble breathing, I would consider calling the ER and saying, look, I tested positive and I'm having trouble breathing. Or call me and I'll talk to you. But I've been talking to you now for 20 minutes and you haven't coughed once and you're not breathing through your mouth. And when I joke about things, you smile and you breathe through your nose. I mean, you're not in trouble right now. And they felt better about that. He's actually going up and getting tested tomorrow because they want to know if it's in their household, and they want to know. Then I had to tell them, look, I'm not worried about your house, but if you've got the coronavirus, then it's very important for the world for you to stay at home, until the symptoms are gone, and in 2 weeks after that. And I said that, we're all asked to do things when our time comes. And we're not fighting a war, against another country, so we don't have to ask the military to jump in and put their necks on the line. But we're asking every individual to do what's right. And I think in your case, if you're nervous, let's get you tested. And if you're positive, then just treat your whole family. You guys are going to do fine. And then try not to spread it to anybody else. And at the end, they had this big sigh of relief, and the world wasn't ending, and everything was fine. And so we're getting them tested, and then I moved on to the next person. But that takes a long time because they have a lot of questions. But you really just got to talk to them. Are you sick or aren't you sick? And if you don't need to be intubated, or you don't need oxygen, or you don't need IV fluids, then you do your part and try not to spread this to anybody else. And certainly don't spread panic to anybody else. That's the best I can tell you.
Thanks, Dr. Curtin.
Oh, I appreciate
Sure.
it. Thanks so much for joining us. I know that you've got long days and you still have meetings tonight. So I think, I appreciate that. When I listen to Dr. Curtin, Dr. Andrews, it reminds me of the conversation we had this morning when you were talking about some of the conversations you have. And as a psychiatrist, you have people who are coming to you because they're not feeling okay in their mind. Do you want to shed some light on what's happening in your world of psychiatry these days?
Yes, the folks are, first of all, half of them want to come into the office, the other half are doing some remote service. So when they come in, they seem to be very calm, but they'll say that they're scared. And the thing that we want to focus on is the breath, is the breathing. And in all, most of you have done the yoga and maybe traveled to Tibet and all those places. The breath is the most important, the prana, that's the life force. And so we really want people to focus on their breathing. We want them, just when they're just looking at us and talking to us, we want to make sure they're breathing consciously, breathing deep, breathing in deeply and letting that diaphragm go down so that they're not breathing in their chest and they can see their tummy expand. And also we do that and they start to feel more powerful. They feel more like in control when they take that little exercise. Another thing to do is since most people are shallow breathers, there's not much expansion going on here up in the chest. And so we ask them to breathe in as deep as much as they can and just hold their breath and see how long they can hold it to really oxygenate all the tissue and so forth. And so it becomes like fun, but then but they're given an assignment to do that, maybe 3 minutes a day. And so it's interesting how their capacity for longer holding and bringing in that oxygen that lasts. And so they make like a game of that but they see how better they feel once they can bring in more oxygen and they have control of that breath. So we get them focused on that. And then just in general, just that 4-7-8 pattern, because we really focus on the breath, because they can do a lot of talk, but if they're shallow breathing, it's not much happening because they're still in that sympathetic fight, flight, and fright modality in that state. We've got to change the state. We've got to change the state. So we make a little sing song about it or whatever. We must change the state. Most of the people are in the what if. So we changed, to what if I'm successful at this? What if my family stays well? What if? And so try to change but they have an assignment to change their what ifs, because what if is a pattern for some people. Some people like to do the what if, so they just need to reframe. If they like to do what ifs, they need to reframe it. So that's kind of the focus, because they have to work at it. They have to do something different. And as soon as they do something different, they start feeling more empowered.
I'm gonna. There's a big smile on my face because I think it's interesting. Stephanie, you asked Dr. Curtin, what could we provide people as people who are as community leaders committed to trying to be a positive influence in this season of fear, this epidemic of fear. How do we give people a sense of confidence that the world isn't coming to an end? And I'm smiling because Dr. Andrews, you've been a psychiatrist and you've learned all of the biochemistry of the brain and how it influences our emotions and our ability to concentrate and all that. And here we are. You can turn on the news and some people are talking about this coronavirus like it's going to completely wipe out our existence. And I say that, I know that that's an exaggeration, but to some degree, we talked a little bit this morning on the phone, and we talked about just when you get afraid, you start to get agitated, and then you start to have your rational thoughts.
Yes.
And if everyone wants to put their hand right in front of their face, it's almost like when you get afraid, if you keep focusing on that thing that you're afraid of, it like is right in front of your face, and you can't even see anything around it. So breathing is a great way to empower people to oxygenate their cells and really begin to expand their respiratory system and really begin to calm down and be present and connected to your body. Because a lot of times, and I think you probably could speak to this better than I could, some of you just who have worked with reframing or talking people down who are stressed out, it's almost like you need to be present with them and begin to get them focused on their mind on something else, like their breathing. And with Dr. Curtin, you know, with his patients, and I know that for those of us who are caring for people, you just have these conversations and you're trying to get people to kind of, you know, get down off the ledge and just begin to orient yourself to what is real. And you don't need to be a trained clinician to kind of just check in and say, okay, what, you know, am I breathing? And be able to focus on something that is not fear-based, because the minute you're focused on fear and it's in front of your face, your mind can't get around it. And so breathing, it's helpful because it oxygenates your cells and your blood, and it sends out all kinds of nutrition to the rest of your body, but it also allows your mind and your body to be occupied on an activity that's not having you being consumed by fear.
Yes. Yes.
Because once we start, if we have any kind of double-mindedness or anxiety, when we start to get afraid and the sympathetic nervous system is triggered and we have this cascade of problems, the other thing that happens is we start to spin in our mind, and then we start to get irrational fears. And these thoughts, they're exaggerated reality. And so, we see that. We see that on the news.
Yes.
We see that. We as humans, we've been so conditioned. Survival of the fittest is to stay away from the boogeyman. And I think at some point in time, in the shadows of this invisible virus,
Penny, I'm not sure if you can hear us. It looks like your video and your audio froze. I think while we're waiting for Penny to come back, Kathy, maybe you could send her a text and see if she could go to her hotspot. I'm not sure if it's the internet at her house, or Karen, maybe you could, because I think Kathy's recording on Facebook. If you could send Penny a text. I guess Dr. Andrews and Dr. Curtin, I'd ask you the questions, and Kathy as well. What can we do to boost our immunity in these times? I think we've talked about the importance of our breath. Penny, it looks like you're back. I had just asked for Dr. Curtin, Dr. Andrews, Kathy, and yourself to talk a little bit about boosting our immunity in these times. We had lost most, Penny, of what you had just said.
Oh, that's okay. I probably wasn't meant to say it. Someone else was supposed to talk.
Yes, the question is how to boost the immunity. She was bringing that to you, Dr. Penny.
I think you can take it from here, Dr. Andrews.
Okay, and boosting the immunity, I know that, and I've been hearing about it. It was sent to me by a doctor who appears on a PBS station back in February, that the vitamin C coming out of the Orthomolecular Medical Society, and there's research, of course, has been backing this up for years, but that this virus is very sensitive to vitamin C. And so just in general, I tell my folks that they need to have the vitamin C, 400 to 800 milligrams a day. And if they get sick, whether it's whatever it is, if they don't know what it is, but they get sick, then they can push that vitamin C up to bowel tolerance, until they get a little diarrhea. 1 to 3 grams of that. And so that's for, once you prevent it, it's 400 to 800 milligrams. And then after that, if you think you're sick, then you can go up to 3,000 milligrams. And vitamin C gets excreted out, and it's not going to be harmful to the person. And they're also infusing vitamin C, but that's another level. But I do see road signs saying, infusion rooms. So infusion of vitamin C, they use it for cancer and all other kinds of illnesses. So this particular organism is sensitive to vitamin C per the information that has come to me from by way of the links to the Orthomolecular Medical Society, and also it's online. It's coming out of China as one of the strategies. So we just tell them to take their zinc and the vitamin C to prevent to build their immune system. There are many ways to do that. We use essential oils. We use making sure we get good sleep, good night's sleep, and rest. and eating well, staying away from the simple carbs like the sugars and more complex carbs, and so that the immune system just continues to strengthen. And so those are some tips that we give them. Of course, the exercise so that they get plenty of the oxygenation of their tissue and that kind of thing. So immune system boosting is what I think is where it's at, and we need to bolster our immune system. So that's where I focus on.
Kathy, you've been quiet. You have anything as I have the privilege of co-laboring with Kathy a lot in Living Well when we take care of people. I think as we've heard here tonight, sometimes the most powerful medicine is just a compassionate ear. But it always helps to have people who are clinically minded. And I'm lucky that Kathy is an amazing nurse. And so she comes with lots of wisdom. I always kid people to say that I haven't, Dr. Curtin is my family physician, and I'm not a very good patient all the time, but I think he told me the best thing I can do is to stay out of his office. And so I'm proud to say that as an adult, I haven't needed to do a whole lot of medical attention, and I'm grateful for that. But Kathy has been by my side, and she, at some point in time, as I got a little older, and I think it was because she wanted to make sure I was going to stay at work and work really hard. So she put like a little pill bottle together of ibuprofen and I don't even know which ones I'm supposed to take. So somewhere between Dr. Curtin and Kathy, they give me these instructions. But it's kind of nice that you don't have to suffer from some of these symptoms. I mean, I think my desire is always to prevent that. But yeah, I have this little arranged pill bottle, and I still call Kathy and say, what color pill should I take if I'm working and I'm too tired and my body aches and I think I'm fighting the flu, and she still wants me to go back to work? She just says, take some of these pills. So Kath, do you want to add at all anything to that?
I'm not sure after that introduction that I should add anything. But as I listen to Dr. Andrews and Dr. Curtin and just all of us, I mean, I think just taking care of yourself. I mean, building your immunity. One of the things we know that interconnectedness helps to build compassion together, and we just need to really pull together and just love yourself and love others. And I think even those simple things, forget the pills, forget the ibuprofen, and just build up your own immunity and make sure that you're taking care of yourself. So by loving yourself and loving others, I mean, that would probably be the best medicine at this point in time.
That's so exciting. So tonight you heard several physicians and a nurse, and we're talking about compassion and love and vitamin C. And again, I'd like to, for those of you who are listening to this, I want you to know that we're not irresponsible providers that don't recognize the importance of interventions that are life-saving. But I do think we minimize the value of simple relevance and compassion and love and interconnection. I can tell you, for me, I have seen the power of love do amazing things. And I've been fortunate to surround myself with people who have a passion to love and serve other people. And I think I want to make sure that the people who are listening and those who are ridden in fear and feel like the world is coming to an end, whether that's due to financial burdens, whether it's symptoms that you're just not exactly sure where the cause is, or whether you have relationships and you're stressed out in your home, living with your family and being isolated. I think for some people, this isolation, it can turn into a blessing, but for some people, it creates increased stress. And if there's a financial burden, we know that those things, they compromise your immune system and make you more susceptible to getting sick. And so I just think, let's not minimize the value. And I know that we might need to exercise some level of social distancing, but there's a difference between social distancing and being disconnected. And I think in Living Well, we talk about being connected within ourselves, mentally, physically, and spiritually. And we talk about when we talk about spiritual health and well-being as it relates to the virus, I think we don't want to minimize the value and the importance of just of being loved and feeling peace and rest and being content. And I think for those who have a spirituality, whether that's, your relationship with God or going out into nature, none of those recommendations are prohibited in this season. And so sometimes, if you have if you're receiving the confidence and the encouragement from good healthcare providers that are saying, look, if you're not short of breath and don't have a fever and you're still able to breathe and feel like your body can fight, don't forget to dig deep and connect to the source that gives you life and passion. And so this season of change, of unprecedented, it might have disoriented us, and we need to reorient. But our goals is together to be encouragers of one another. And I don't know about you guys, but there are people now that it's almost like they've been bathing in the forest of fear for weeks, and it just, their fear just gets bigger and bigger, and you may need to establish some boundaries from people who make you feel bad. And so that's another way to address these situations, is to put yourself in environments that make you feel loved and encouraged in these times.
Penny, one of the things I would add, you talk about people that are bathing in the forest of fear. I don't think we've talked about nature. I think you had talked about the ability to be outside, and we've talked about exercise a little bit. My background with experiential education is really to get people, youth and adults, connected to the natural environment. And that from a stewardship perspective, my background was doing environmental restoration, but I recognized early on in that part of my career path that if people didn't really feel a connection to the land, they weren't going to care for it. And there was a symbiotic connection between people caring for the land and the land providing something to the people. And I came to realize after I had stepped out of that career and into community health with Living Well, that the Japanese had figured this out centuries ago. And it's interesting, when we orient ourselves to the season we're in the Northern Hemisphere, we think about the cherry blossoms and everything that's blooming. The Japanese, for generations and generations, have spent time in nature for the healing benefits and the therapeutic benefits of just being outdoors and what that can provide for us. And that's really just, it's a stroll in the woods. The idea of taking a forest bath is really not to take off all your clothes and go take a bath in the creek, although in the summertime that could be appropriate. But really it's to immerse yourself in that environment. And they've done scientific research, it's evidence-based, to show the decrease in stress, the boost to your immune system, the boost to your mental health, the boost in creativity. So, I realize for us in Pennsylvania, we're fortunate that we have a lot of parks and open space and game lands. Our Fish and Boat Commission actually opened up for trout season and encouraged people to go out. I think for a lot of trout fishermen, they were probably encouraged by the social distancing. For anybody that knows the first day of trout season, they're back to back to back. So having people a little space. And they encourage people quite explicitly on their website to say, this is for your mental health and for your physical health, that we're encouraging you to go outside, honor the social distancing, and to not be out and around people if you're feeling sick. But I'd encourage everybody to go out, and whether it's a walk around your neighborhood, if you're in an urban area, and just appreciate some of the benefits of the season. Even if that means it's a spring rainstorm, when it's windy, there's a tremendous benefit to that. And I would also ask my friend John Sponingberger, who introduced himself saying that he's stepping out of one career and looking forward to retirement, but he helps facilitate some of our programs. And I think he's been really creative in ways, and whether it's playing music or doing artwork, I think if you'd be willing to share some of the creative ways that you've taken care of your mind, body, and spirit in these times and managed stress, we'd appreciate it.
I think one of the biggest things, me and the cats dance. We dance together. We have a dance hour every day. They get to pick the music sometimes, but mostly it's me. Not being in the office and work has been really beneficial to me. Not only the fact that I'll be retiring, because I'm not in that system or, in that environment that is toxic. And I didn't notice it until maybe being out about 2 weeks that I feel better. I'm not stressed at all. I sleep better. I want to sleep longer. I'm not up at 4 o'clock every morning, anticipating what I got to do today, and then go to work, at 6:30 or 7 o'clock, and then do that all day. So it's being aware. I believe a lot of it. I chant during the morning, which really helps me. And I don't turn on the TV to listen to this stuff. I really don't. I mean, I understand that, the media has their job. And I'm not really sure sometimes what it is. So I don't want to be real cynical and say what I think of this. But being in today, living for today, doing what I can to take care of myself, trying to eat right. I've been, quite honestly, I haven't been eating very well. I mean, I eat, but I don't eat very well. But I keep telling myself I'm going to restart, because when I did that, it was best. But I do try to get out during the day to do something outside, like go for a walk. Yesterday I was down at City Island, looking forward to be back up at Boyd, and then looking at other hikes in these books and things I have for over the summer that I can do before I really start to engage in something else. So, I'm feeling pretty good by not paying attention. So, ignorance is bliss, so, right?
Well, I appreciate that. And I think even your orientation to environment, we talked a little bit about the natural environment, but your awareness of having been in a toxic work environment, and even the stress that predated the shift that all of us made in the last few weeks, at least here locally, is really important. And to look around in the environment that you're now in. And I think for John, that he's having the dance hours with his cats, I think that's amazing. And if your home environment, and whether that's your home inside here and your body doesn't feel good, I think we've had physicians and experts on tonight actually orient you to look inward and say, what's going on? Can I breathe? Am I doing deep breathing? And orient yourself to your perspective. And Dr. Andrews, I don't know if you would contribute to this as well, even people's ability, and you could clarify what it is psychologically, but orienting to a new perspective. And Penny talked about, if fear is right in front of your face, how do we encourage people to experience something new and to shift their perspective of what environment they're living in, whether it's their environment in their mind, their physical environment, the environment in their heart, and the fear that they feel?
That was a question. It sounds like it was a question, but you were so comprehensive. You had all the answers built into the question. But that's very insightful. But it's like, okay, it's like there's something, they used to have something called contact paper, and so you had, before you could use it, you had to remove that sticky thing, the thing that was protecting the sticky from it. And so when people come with their, with the fear, or with the subject that's related to the fear, or expresses the fear, you have to get that layer, that thing that's stuck to the paper, have to get some space there so that you can get in. And so that's really like our work, when they come in, to get that space there. And so like you pointed out some ways that that can be done, but that's my aim, is to get some space there. So change the rhetoric, reframe it, encourage them, get them to laugh, or get them to think differently from how they were thinking. Again, what if you were successful? What if you you shed that weight while you're on lockdown? What if, and change that, then you get a little space there. And then when you get that little space, then you can start to instruct, give them something to do. And we do a lot of the emotional freedom technique, because it's very, very effective. It changes things very fast. It's energy psychology. And so we do that. And it gets things moving very rapidly. So, but again, you have to create that space, and you just pointed out a couple of things that do that.
Thank you, Dr. Andrews. Mm-hmm. You're on mute, Penny.
Yeah. Before we end this evening, does anybody else, Karen, Ed, anybody have anything they want to contribute?
The one thing that Dr. Curtin told in his story, which I thought was pretty powerful, which he reminded his patient like who he was. And he told him, "You are Superman." And the reality is that all of us have that in us, and that in us we have access to this well, and it's a deep well, and we have internal resources as well as external resources, and to realize we have a choice as to our next breath, our next thought, our next action, and to be intentional as to what we choose and how we move.
Thanks, Karen.
I guess another observation I would add in closing, and Penny, I think you can wrap it up, would just be that we've had some professional care providers on the team and other providers that have years of experience taking care of people in community. But the reality is, like Dr. Curtin said, and even Dr. Andrews, what we're hearing from the physicians and the mental health providers is, if you can, don't come into the office. And so what that does is it really shifts the dynamic in the community to encourage people to actively take care of themselves in ways where they may have just gone with a minor symptom into the doctor's office before. And I think hopefully tonight, this conversation has been able to provide some tools and things that you can do at home on your own, and really taking an active step towards your own health and well-being.
Well, thank you all for joining us. Those who've joined us by way of Facebook or get to watch us off of our livingwellinstitute.net. I think we have it on our Facebook. We'll have it the recording of this, right, Kath?
Yep, we'll put it up.
Pardon me?
Yes, we'll put it up.
Yeah. Well, I think a couple things just for those of you, when you think about stress and its impact on your immunity and your resiliency, I think Dr. Andrews talked about EFT, or its emotional freedom technique, or AKA tapping. And if you Google, it is a very simple exercise that has you changing and reframing the way that you think and stimulating certain areas on your body. And as a psychiatrist who has kind of stepped outside the box of traditional perspective and has added functional medicine and more of a holistic appreciation for that, I think we just want the audience and those who are really struggling with what is the truth to know that there is there's a wealth of hope and knowledge that we have within us, as well as when we confront the realities of our fears, just the whole concept of enjoying life and being present and exploring creative opportunities, whether that's nature or dance. I just want, if anybody feels the need and they're stuck, again, Dr. Andrews has a practice over on the West Shore, and she's a psychiatrist who really has, I've enjoyed taking care of people with her, and Dr. Curtin. They have practices that every day they're answering the questions on how do we address this coronavirus. And tonight, the hope would be that you've gathered some resources that allow you to know that you do not need to live in fear, and that your body is an amazing gift, that health is a possibility if you continue to press into this season and explore and discover the truth and the health that is within us. We have accessibility to an abundance of resources. Don't minimize the value of the ones you have within. So thanks everyone for joining us, and we'll look forward to catching up. We meet in the upcoming week. We have a Live and Learn tomorrow at 12 o'clock. You can check that out on our Facebook. Tomorrow evening, John and Stephanie and Ange, they facilitate a recovery group that provides the opportunity for those who may be struggling with addiction to be able to, if you or your family members have heightened stress and have concerns relative to addiction, they're going to be having a conversation tomorrow night. On Wednesday at 3 o'clock, Kylie, who happens to be my daughter, she leads an interactive fitness program that you're welcome to attend. And then Thursday morning at 7 a.m., for anybody who would like to join us again, we'll have another open discussion on whole person health during this coronavirus, and together as a community try and support each other as we find constructive and productive ways to walk through this journey. So thanks you all for joining, and thanks for those on our team who've contributed, and I greatly appreciate your contributions, Dr. Curtin and Dr. Andrews.
Thank you for inviting me. I certainly enjoyed it. Thank you.
Okay. Have a good evening.